Iliotibial band syndrome occurs when tightness in the IT band causes the distal end to rub on the lateral side of the knee. People usually feel pain on their knee when running, jumping, or doing anything that involves knee or hip flexion. The IT band serves as an attachment point for many muscles at the hip. These muscles consist of glute medius, glute maximus, and the TFL and vastus lateralis. All of these muscles can impose tension on the band if they are tight. The overhead squat shows knee valgus, signaling weakness in the abductor muscles. The lateral view shows slight anterior pelvic tilt, which could be a result of tight flexors. Upon finding weakness in the abductors during the overhead squat, we measure range of motion of the glute med, which is the prime abductor. Next, we muscle test gluteus medius. If glute medius is weak, this could be causing the TFL to overactivate as it compensates for the weakness. Lastly, we use Ober's test. This is used to test the tightness of the IT band. A test is positive if the leg doesn't fall into adduction right away, as in this case. This means the band isn't being able to stretch properly. The IT band itself cannot be rolled out because it can withstand up to 1,000 pounds of force. What we roll out instead are the muscles that surround it that could be overactive and could be causing the tension. In this case, we roll out the TFL and vastus lateralis. Primarily, we want to lengthen the TFL as this is the most tight. We can do this standing or using resistance to target a deeper stretch. To isometrically activate gluteus medius, we can have the patient lay on their side with their leg abducted and have them hold that for 15 seconds at a time. This can be done with or without resistance depending on the patient. Lateral band walks dynamically activate gluteus medius. Subjects should slightly bend the knees and take wide steps for better results. Clams are great for activating not only abduction but also the external rotating fibers of the glute medius. Lastly, we can have the subject perform 2 sets of 30 leg raises on each side to finish with the activation portion. Single leg deadlifts will integrate the muscle into sagittal plane motions by keeping the knee from caving in as well as keeping balance. These can be done with or without weight. Leg swings are different from leg raises in that the adductors are involved in this motion. This allows them to work together in stabilizing the hip. Lastly, this side plank will bring all the muscles to work together isometrically. We can intensify this exercise by having them raise their arm towards the ceiling.